Hello, happy dwellers, and welcome to the Happy Dwelling Podcast. It's a pleasure to have you here with me today, and I hope you have been well and are creating those great habits so your dwelling place can be a happy one. When it comes to health, there are 1,000,001 ways to go about trying to stay healthy or maintaining a healthy lifestyle. And this is important because you can be inundated with so much information, so many different opinions, and not really know what it is that you should or shouldn't do. Now, today's topic is something that I was recently introduced to this year, and it was something that was never on my radar when it came to living a healthy lifestyle. But one thing that I like to gauge as an indicator of health is the way I feel. Like, there's a feeling that you get after you eat a salad, right? You feel light, you feel energized, your nasal passages feel clearer, you feel like your brain is sharper. Same thing happens when you work out. You feel sharper, you feel better, you feel awesome. Now, today's topic is something that I never would have associated with that feeling, but since I have been introduced to it and have been incorporating it in my life, it has been showing effective in giving me that feeling. And that is chiropractic, right? My introduction to chiropractic was from a friend who got in a car accident, and he said that it had helped him. But I didn't know anything outside of that. I knew of an A&P professor that was super into holistic health, and he always talked down about the medical system, always talking heavily about holistic health and things of that nature. But I didn't really know what chiropractic was or what it did. And since I've kind of been in this realm, I now have a better understanding of what it is and how it works. And I got introduced to it through Dr. Timothy Smith, who is my guest today. He's been a chiropractor for about 11 years now. He runs his own office, and he regularly adjusts myself and my daughter as well. And since he has been doing that, I have been feeling that good feeling of that sharpness after I get adjusted. I feel lighter. I feel happier. My mood is better. And I never would have thought that by moving bones a little bit, that would be what happens for me. And then for my daughter as well, she had ear infections, and I got her adjusted a couple times in a week, and it helped to get rid of that ear infection, I think, faster than what it would have been without of that. And this is just something that I wanted to share with you all because it has been effective in my life. Once again, there are 1,000,001 ways you can go about health, but I think that this is something that could be helpful for a lot of people if you actually give it a try. And understand that it's not just for people that got in car accidents or dealing with headaches and migraines and neck pains, whatever the case may be. This can be something that you can incorporate into your healthy life starting now. And it's simple. And so I just wanted to share that with you. And I really hope you guys enjoy this episode because there's a lot of gems that are dropped. There's cool stories that are given outside of my own that can show you the power of chiropractic. And as always, don't forget to like, share, subscribe, rate, review, all the things because it means a lot. And now into the episode. Can you tell me something that you're grateful for in this moment?
Freedom. Grateful for freedom. There's a lot of people who don't have the freedoms that we have and get to enjoy and experience on a daily level, let alone an hourly level, whether that's through their place they live, whether that's through governments, whether that's through relationships, whether that's through themselves and their own imprisonment. They don't have the freedom. So I'm very grateful for that and having the ability to express and enjoy how I'm feeling at the time, or without imprisonment or fear of being locked up or something, especially how we've been health-wise in the past 2.5 years. Freedom's a big thing here in the States. So
yeah,
how about you?
Oh, I didn't expect that. I guess I'm just grateful for the sun. I know that sounds so simple, but just
that's so good though. So complex.
It is.
Yeah.
And I'm just trying to find gratefulness in simple things. But your answer was so interesting. I never had anyone tell me that when I asked them that question. So that's interesting. And I think that is definitely something that we should all be grateful for because we do have that flexibility here in
Yeah.
America for the most
If you've
part.
ever been to another country and experienced their stuff and
Hmm.
realize how good we have it here,
Yeah.
uh, very, very insightful, let's say that. And
Interesting.
yeah, and humbling at the same time.
Yeah, for sure. So let's go ahead and get into it. I wanted
Mhm.
to ask you a little bit, give us a background about who you are. Just tell me, how do you describe yourself? Who do you say that you are? And what is your, I guess, your purpose in life here?
Well, yeah, I'm Dr. Tim Smith. Obviously, you know that, but I am a chiropractor. I'm a max living chiropractor. We focus on 5 essentials of health, which are 5 principles that when you get those in line, your health just naturally comes the way God intended and put inside of us. So, I won't get too much into the max living side, but just overall, I am a chiropractor. I'm a son. I'm a brother. I'm uh, a fear of God, of course, but also, I'm a husband and I'm a father and a chiropractor, and I feel like I'm a big part of the health community in our area um, as a chiropractor. And that's a good question. Now, what?
Yeah, I think you did a great job describing that, because most times when people ask who they are, you do incorporate those relationships and what you do. So that was
Mhm.
excellent.
Okay.
So you are a chiropractor. You're the first chiropractor that I've ever really, I guess, got a chance to know.
Mhm.
Can you tell us a little bit about why you're a chiropractor, what got you into it, and what's the story behind all that?
Yeah, pretty interesting actually. I was growing up. I didn't feel anything towards chiropractors or anything. I was at doctors a lot. I was very sick as a child, and if you've ever been a parent or been around parents with sick kids, um, you understand that everything gets put on hold for the kiddo. So the
Yeah.
whole life gets put on hold, the parents' life, the family life, and so I was the beneficiary of everything, my whole family's life being put on hold for me because I was always sick at the
Mm.
hospital several times a year with mostly asthma related issues, allergies, immune issues. Several times a year, I had diagnoses of bronchitis, pneumonia, some kind of lung pathology, and it all centered around having this asthma too. So I would take my albuterol inhaler, the little rescue inhalers,
Right.
all the time. So pharmacists would say, you should go through the entire canister of medication, which is 200 inhalations, 200 puffs, 200 doses. The entire canister should take around 4 to 6 months to go through the entire um, prescription before I needed a refill from that pharmacy.
Mm.
And I would be going back every 6, 7, 8 days for
Oh, wow.
refills because I was living off that little inhaler. And if I didn't have that, my lungs would seize up. I couldn't get any air in, and I just couldn't go to sleep. I couldn't go up a flight of stairs. I could barely even walk across the grocery store with my parents
Wow.
without getting winded. So, needless to say, playing sports was hard. Even though I love to do it with my brothers and such, um, I was very involved, but I had to use my inhaler all the time. So I had lung surgeries when I was age 12. I had 3 weeks in the ICU. I got medevaced to hospitals because they said, we have to transport you from this ER to a different hospital. And if we take you via ambulance, you'll probably die on the way. So because my blood had turned so acidic from the lack of oxygen, I had so much carbon dioxide, they said, you won't make it to the hospital via ambulance. So we have to take you via the helicopter. And I'm like, I'm at the hospital. You're supposed to be saving lives here, but now I have to be. And I didn't think I would got like a gunshot wound or a stab wound or anything. Like this is life and death. So I didn't really understand how intense it was at the time going through it.
Wow.
Now I've come out of that and realized like, wow, I was a sick kid, and I always turn to hospital drugs, medicine, doctors, nurses, and they always saved my life. Which in the U.S., boy, we have great emergency care system here for those type of things. When in terms of managing health, it's one of the worst countries to be in. We'll get to that later. But growing up, I always turned to medicine because I was always sick, and so I got through high school and ended up being a pretty decent football player. So I got a scholarship to play football in Kansas at a school called Friends University. And through working out and just through different sports and things while playing football, I hurt my low back. And I started seeing this in a roundabout way. Someone said, "Hey, you need to go see a chiropractor." And I didn't. once again know what they did, but I knew they worked on people's backs, and my back hurt a lot. So I went to this chiropractor, didn't know how to feel about him. He was dressed kind of like a hippie. In August in Kansas, it's like 110 degrees and 110% humidity. And he's wearing turtleneck sweaters, and like he smells of like oils and like flowers and patchouli and such. So I'm like, this guy's the most eccentric doctor I've ever met in my entire life. But he didn't wear a white coat. He didn't have a stethoscope.
Right.
So, and then he started talking bad about other not the chiropractors, but other doctors that, they're killing people with drugs and medicine, and they're overdone, they're overused, they're all in it for the money, not in it for the people. And I'm thinking, this guy's a doctor bashing doctors. Should he be like doing real estate or something instead, or like maybe be a lawyer, because he truly hates his job.
Right.
But seeing people at this office, I'm like, they're very happy, so there's something to what he's doing.
Right.
So I started getting adjusted, and my back immediately felt way better. And so I noticed I could play football for longer, and I could sleep throughout the night without any aches or pains. And I was actually sleeping throughout the night without asthma attacks, like I always had. I quit taking my Allegra and Zyrtec at the time. Those were prescribed allergy medications. I didn't have to take those anymore because I was going through the fall season without any allergies. I did get a cold or a flu or something, and I said, you know what? I'm going to let my body fight this instead of going to the antibiotics or going to the hospitals and the doctors. And I realized, wait a minute, my body is like insanely brilliant. And I started talking to this chiropractor I was seeing, and I said, hey, whatever you're doing, like, I appreciate this. My asthma's getting better. I feel like I'm getting stronger. My back feels fantastic. So whatever you're doing, I appreciate that. Are you trying to like fix those things too, as well as my back? And he looked like puzzled. He's like, what are you talking about? I told you the first day you came in here, I'm not going to treat your ache or pain or symptom. I'm just letting your body heal on its own the way God made you to heal.
Wow.
I'm like, wait a minute. So he wasn't treating pain. He wasn't treating the symptom. He wasn't treating asthma. He wasn't treating allergy. All he was doing was letting my body and my innate intelligence express itself the way it was supposed to be expressed throughout my entire childhood, which was only kept me alive with drugs and everything, but never let my body heal the way it's supposed to, because the interference was in the way in the nerve system. So I was going to be a PE teacher. I wanted to coach high school football. Decided that, you know what? While I would love those things, I would be a way better chiropractor, and I would impact lives and humanity way more, but because I was impacted that way. And I tell you this, my parents had no idea that taking their sick kid to a chiropractor would help them.
Right.
All they were told and all they ever knew was doctors, drugs, surgeries, emergencies.
Right.
No one ever told them, like, hey, take your kid to a chiropractor. They work on the nervous system. That system controls everything. Why would you not take them there first, so the body can heal, it can function? And I get to be a part of the solution now, that people take their kids to me first instead of the drugs and everything. So I feel like that's what got me here anyways. So hopefully that answers your question.
Yes, you definitely answered the question. That's an amazing story. I knew it, but I didn't know it in depth like that. So I think that's you really had a turnaround story, or turnaround take place in your life. That's beautiful. So my idea of chiropractic before I met you and your lovely wife was, you get in a car accident, you have some back issues, go to a chiropractor. Or that happened to one of my friends, and he was like, I like going to the chiropractor, but my insurance only covers like 12 a year, so I don't go often. So that was my understanding of chiropractic. And I also had an A&P professor that was a chiropractor, and he was a little bit wonky. And he was into holistic things and stuff too. So that was my understanding of chiropractic. But can you kind of speak on why chiropractic works and why it could be used for everybody, not just people who got into car accidents?
Yeah, it all goes down to what controls every single cell, every organ, every tissue. All function in the body is controlled by one thing, and that is the brain, spinal cord, and whole nervous system. So for the heart to beat, for lungs to breathe, for your stomach to digest food and make it into eye cells and into heart cells, into hair cells. All that happens through the function in the body throughout the nervous system. So, if we always say, if you cut the nerves going to the heart's going to stop. If you pinch the nerves going to the heart's going to be alive, but not fully alive. It's going to be having a lack of function, or what we call dysfunction. So dysfunction is going to lead to pathology, disorders, diseases, and taking that interference out of the way via removing the subluxation, which is subluxation is a pressure on the nervous system, blocking that mental impulse, that mental flow from the brain to the organs and tissues. Removing that subluxation allows the body to restore that natural healing pathway, or the natural innate intelligence to restore that function and increase the innate intelligence being expressed through the individual. Basically, take pressure off the nervous system, the body's going to work better, more efficiently, more effectively, the way it's designed to by our creator. It's amazing how it all works. So chiropractic, while it often gets painted with the brush of pain and dysfunction or headaches. Oh, puppy, sorry. While chiropractic often gets painted with that brush of pain, headaches, and things like this, that pain is merely a manifestation of something going on deeper in the nervous system, and you address the interference within the nervous system, and the body will return to a state of normalcy, whether that's relieving pain, whether that's getting a good night's sleep, whether that's reducing high blood pressure, or returning normal cholesterol levels, whatever it may be. Your body functions the way it's intended to, while for getting adjusted. And anybody who can benefit from that, if there's definitely a criteria to those who can benefit from it. A, they have to be alive.
Right.
And B, they got to have a nervous system. So if you have both of those, then you can benefit from chiropractic care at some level.
Right.
Now, there's limitations to everything. So obviously, I've never adjusted a paralyzed person and they started doing backflips right away. Like, that's, while miracles do happen, it's not up to me whether they do backflips or not. It's up to the person's innate intelligence to be expressed to properly respond.
Okay.
So whether that's in 12 visits through the insurance company, or whether that's through a car accident, that trauma is going to be, through the car accident, is going to cause a subluxation. Chiropractors merely remove the interference or the subluxation to allow normal function to restore within the body's tissues, glands, and cells.
Right.
So, and that doesn't happen in 12 visits for a lot of people. So insurance companies, for someone to be restored to health, that's not something that health insurance will cover.
Yeah.
It's more like sick insurance. If you're sick, you have insurance for sickness. Like car insurance isn't car insurance, it's accident insurance.
Right.
You don't use it if you have a car, use it if you have an accident. You don't use health insurance if you have health. You have health insurance if you have sickness, disease, injuries.
It's true.
So
that's a good way to look at that. I never put those two together. So
that's
excellent. So it sounds like chiropractic works to, like you said, make everything function better. So in your experience, since you have been a chiropractor, can you tell me some stories of how people's lives have changed once you took pressure off of their nervous system? I
got so many. Obviously, I get to experience it on a daily level at some degree, whether that's just in the office or even at home. One life I know I've changed is my daughter. She's 4 years old now. When she was first born, she was born via emergency C-section, which happens to lots of babies. And we, as a natural parents, we thought we did everything right with the birth or the pregnancy process. But last second, we had to pull the trigger on emergency C-section. So when babies are born through the birth canal, their heads get squeezed together, and all their body gets basically squeezed as they come out of mom to the canal. And that kickstarts the respiration cycles, the respiration process. So babies born via C-section don't get squeezed and don't go through the canal that way to help jumpstart the respiration centers. So in the brain and body. So C-section babies often have lots of lung issues where they have fluid that gets stuck in their lungs very often. So Kimber was born, and we got up from the the recovery room up into the hospital room. We're supposed to stay for a few days, and all the nurses and doctors and orderlies, they all leave the room. So finally you have some peace and quiet after, days of laboring. So my wife's Madison's, she's sleeping, and Kimber's a little, fresh little baby in the little clear bassinet plastic thing they have there. And I thought, okay, now I gotta check her out. I gotta adjust her if she needs it, and start checking her out. And she's very like unsettled, kind of fussy, and bright lights and everything. So she's kind of wiggling around, and I feel that top bone in her neck, the atlas, the C1, the very top bone in the neck, just where the brainstem kind of sits in. And I felt it shifted out of place to the left. So I take my finger and I lightly just put some light, gentle pressure on that. And I feel it just kind of slip back in place. And then it felt normal on both sides. Okay. And my mother-in-law was sitting like across the room. She said, "Oh, wait, what are you doing?" And she started taking a picture. I'm like, "Yeah, I'm just adjusting her." And once that bone slipped back in place, you saw this like sense of calmness and ease just kind of come over her entire body. And Joan says, "Wow, that's pretty cool." I'm like, "Yeah, that was cool. Holy smokes, that just like happened like that." And then she kind of just like got real calm and just kind of peaceful. And then within a minute, she started just coughing and like just coughing and coughing and coughing. And then she rolls to the side and just goes, and all this amniotic fluid gets expelled from her lungs, which had it stayed in there would have got infected, and then she would have been back in the NICU within a couple of days of being home because of the lung infection. So that little small adjustment allowed her body to say, "Hey, this stuff's in my lungs. It doesn't need to be here. Let's kick it out." So her innate expression of the innate intelligence happened immediately. So from the first few minutes of life, I know it impacted her life dramatically. And then that's just my own daughter. So who's to say that that doesn't happen to every child when they're born via C-section? We don't know because we don't have chiropractors in hospitals adjusting babies. Right. But that's just one example. More recently, started taking care of a 18-month-old boy who hadn't pooped in weeks, or even, actually it was 8 weeks he didn't poop for the first time. Had surgery to remove all the feces that been backed up because his body was not getting rid of the waste products. And poor guy, 18 months old, he has been through several different hospitals, several different doctors, surgeries. They actually took out his appendix for no reason while they're doing exploratory surgery on his intestines. And that upset me when the parents shared that with me. Yes. So every doctor he's been to has either poked him, cut him, put something like up his butt or something into his colon. And they said, "We can't find anything wrong with him. He's fine. He has to be on Miralax the rest of his life or until he grows out of it," which we know is complete BS. That is, we don't just grow out of something. It changes into something else. So mom was distraught. Baby's crying all the time. Every time he has to make a bowel movement, it's like intense searing pain comes over him. So she comes in. He wouldn't let me hardly even touch him because he's so just traumatized by doctor's offices, which I totally understand. So I just lightly adjusted his tailbone and his sacrum and that top bone in his neck as much as he'd let me. And I said, "You know what? This is all we got, Mom. This is all we can do today. Bring him. This is on Friday. Bring him back on Monday, and we can do more work." And then on the ride home, he hadn't slept in a long time either because he was so like distraught and so much intestinal pain. Right. On the way home, his grandma turned to look at him in the back seat, and he was passed out on the way home from the office. And they had to wake him up and put him in a crib. And they were happy he was finally sleeping because it was the first time he slept in days. And Dad got home from work that day and was convinced the chiropractor hurt his child when his wife's like, "No, he didn't hardly even do anything. I'm surprised that he's even sleeping so well," because the doctor did like nothing. He touched him a couple of places. Yeah. It didn't hurt him. But he woke up and he's pooped and he pooped and he pooped and he fell back asleep. And then he pooped and he pooped and pooped. On Monday, he comes back in Still very scared to see me because it's a doctor's office.
Right.
Adjust him again. Sleeps great again. More diapers are filling up. I meet Dad on Tuesday, and Dad walks up to me and he shakes my hand. And he's a big military guy, very trained, and not a guy you want to mess around with. He can handle himself.
Yeah.
You want him on your team in battle. I'll say that. He looks at me and he shakes my hand with tears in his eyes, and he says, "Thank you for giving my son back to me."
Wow. Oh my goodness.
And all he did was remove some interference and let his body express the innate intelligence that God put inside of him from birth. That didn't take appendixes being removed. That didn't take Miralax. That didn't take all it took. And that was just 1 or 2 adjustments,
Wow.
So I got hundreds of these stories I can go on with, but we got to keep the podcast short. So
Yes. Those are amazing stories. I did not know that about Kimber too. So
really,
I didn't. You guys didn't share that story with me. So that's awesome.
yeah.
Did the same,
She
did the
loves
same?
getting adjusted now. She's
Oh, of
a
course.
chiropractor in the making.
Of course.
Yeah.
Just like her dad.
Yeah, that's
Um,
right. That's right.
My next question is for you is, since I have been in the chiropractic world, it seems like there are a lot of inconsistencies of how chiropractors operate. For instance, some chiropractors decide to do excessive things like IV fluids in their offices, or cupping, or massage therapies, other things that aren't necessarily strictly chiropractic.
Right.
If someone was interested in finding a chiropractor and getting adjusted, what would be your top tips for them for finding a chiropractor that works for them?
So as a corrective chiropractor, I can only recommend for like my close friends and family to see a corrective chiropractor.
Okay.
So that's the first thing. Some places don't even have that. So if you're on a deserted island and you're starving to death, or you're about to die from dehydration, like get something,
Yeah.
So find a chiropractor to begin with. Some places don't have chiropractors, or they have a few. So get adjusted by somebody. A, B. There's 7 things to look out for. 7 things. So number 1, and you can put this on text on the video if you want. So number 1 thing is in finding a good corrective chiropractor is, do you take X-rays?
Okay.
We got to see the spine too, right? We can always feel it. We can always use our indicators, but there's power behind seeing what's going on with that person's spine and structure and impacting the nervous system.
Right.
Number 2 is, when you look at the X-rays, do you get spinal listings off of them? So do you find where the spine's gone out of place? Or do you just look for broken bones and pathologies, just like a medical doctor or a medical office would? We don't do that. We're trying to find where it should be out of place so we can restore it back to normal alignment.
Right.
That's number 2, is do you get spinal listings off the X-rays? Number 3 is the goal of the doctor to simply relieve symptoms or to restore normal function? So you're going for pain relief, or you're going for function restoration?
Right.
There's a lot of pain relief docs out there, and that's where you see the cupping and the IV and massage and detox foot baths and like little fish nipping at your toes or whatever it is. And those are all fine, but they're not chiropractic.
Right.
Number 4, do you take post X-rays after a series of adjustments to document the structural changes?
Okay.
So that's the pre and post X-rays. That's a big thing right there. And number 5 is, are you familiar with how to repair a disc injury? Some doctors don't. Number 6, do you work with pre or post spinal surgery patients? Some don't.
Okay.
They should. And number 7 is, do you work with pediatrics or elderly? And the elderly, so both. So the whole population.
Okay.
Some people just do sports. Some people just do like a certain type of technique or something. Some only do pediatrics, and don't do elderly, or vice versa. But seeing all walks of life is very good. So those top 7 things I recommend people would look for,
Right.
in finding a good corrective chiropractor in their area.
Okay, those are excellent tips. I'm going to write that also in the show notes, and it'll also be on the video screen. So if anybody wants to look back at that, they can totally do that. Thank you so much for all of this. Like, this whole talk was amazing, Dr. Smith. You just chiropractic is amazing, and I just feel like more people need to know of it. So I'm glad that you're here today so that we can spread the message and hopefully let people know to restore function to their nerve system through chiropractic. So where can people find you? I know you wanted to have a podcast, you don't quite have it yet, but where can people find you if they wanted to find you?
So yeah, Facebook is True Source Chiropractic.
Okay.
Instagram is just at True Source, and then all over Google and everything. But we're True Source Family Chiropractic in beautiful Beaufort, Georgia. We're near downtown area, so TrueSourceChiropractic.com is the website. But we'd love to help you out, and you and your family get healthy and well and stay that way. Yeah.
Thank you so much, Dr. Smith, and thank you for coming on and sharing your knowledge, and have a wonderful rest of your day.
Hi, Victoria. Thank you.
Okay. That is all I have for you all today. Thank you so much for spending your time listening to me. I hope you join me in the next one to learn more about health topics that can help you improve your life so you can be happy in your dwelling place. Love y'all.